Welcome to MedMillet software. This video is about patient admission process and its essential tasks after admission in a home health agency. To admit a patient in home health agency, first mandatory task is face-to-face encounter of physician with patient and filled form that confirm patient require admission. MedMillet Home Health Agency software provides all required documentation that are mandatory for admission. First step in admission is create the patient that is to be admitted. From New tab, press New Patient. Fill out mandatory information. First name. Enter patient first name. For example is Demo. Middle name is not mandatory. Can be filled later. Enter last name, that is mandatory with asterisk sign. In this case suppose it's James. Then enter date of birth. SSN can be filled later. From gender drop-down select gender of patient. Then marital status from drop-down. Race, preferred language can be selected later. In address information, street address is mandatory. For example, our patient address is 111th Street, Suite 2. Then select address type, residential, business, mailing any one of these. Enter zip code, as user enter zip code. MedMillet Agency Manager provides valid city zip option to cut off the chance of error. Select the zip, city state will be filled according to provided zip. Contact information can be filled later. Financial guarantor, emergency contact, and all other detailed information can be filled later on. Now press Save. Once the patient is created, second step is to create episode of that patient. Click on New tab from menu bar to create a new episode. Create new episode form is loaded. First of all, we need to select patient, for whom you want to create episode, press Add Patient. From pop-up form select patient. Now all you need is to fill out mandatory information, branch name, start of care date, case manager, and other available information. Press Save Episode button. Entered data is saved, episode viewable form is loaded. Further visits can be scheduled from Visit Scheduler Calendar. Now is to fill upload compulsory forms. In episode form under Orders Grid, 3 forms. Physician order, face-to-face encounter, plan of care, HCFA 485 are provided. Fill out all these 3 forms. Admission is completed. Skilled nurse and other visits are scheduled according to plan of care. In setting modules, pre-admission forms are given in printable format, to facilitate skilled nurse for admission. Patient choice statement. This form is to be filled as proof that patient is selecting agency as caretaker by choice, and if it's transfer from other agency then detail information must be filled. Advanced beneficiary, notice procedures, medical photography consent form, vital signs log. Employee sign-in sheet. Consent form. This detailed form is like a contract proof, between patient and agency, by which agency agent can access patient's medical records to provide better services. This form explains the agency services, and claim payer information. Emergency Preparedness Plan, Medication Profile. Acknowledgement of receipt of information, 5-day discharge plan. Patient Assessment Form, HHCCN Form, Oxygen Risk Assessment, Fall Risk Assessment Action Plan. Abuse and Exploitations. All these forms are available, that skilled nurse required before the time of admission. Thanks for watching.